cells. Hello, good evening, doctors. Will you able to listen me? Yeah, fine. I think so. All of you could able to listen me. Good evening, everyone. This is Dr. 𝗙𝗲𝗃 from 𝗏𝗏𝗄 Medical Academy. Means I'll be there for you for this image-based discussions for next 4 days. And just remember, there's a latency between my voice and your comments for around 10 seconds. Just bear with me till the session. Okay. And let me tell you about the session, like how it will be and for how many days and how many subjects will cover upon. Okay. And this is like, we'll start with this session with which is called as image-based questions. Like there we will cover mostly the most important images we are being asked in your exams and which are having the high probability to be asked in your exams. Okay. And this session, it consists of 4 parts. And today is the first part and rest 3 will be on our consecutive days. Okay. This session, it will be around, it will take around 1 hour 30 minutes to 2 hours. Okay. So just bear with us. And if there is any delay or if you have any doubts, you can ask us in the last part of the session. Okay, that's it. I think so everything is clear now. Like there will be latency, so just bear with it. And if you have any queries, you just write in the chat box. I will be able to reply to it. Okay, fine. Then let's start. Yeah, fine. And in the part 1 session, like there will be of 3 subjects. One is patho, pedia, and OG. Fine. We'll start with the patho part. If you see about this patho part, like we'll start mainly with the basics patho. Okay, fine. If you saw this thing, the first one, we'll start with the necrosis. If you see about this necrosis, we need to differentiate between these 2 necrosis. Like if there is a distortion in the architecture, means if there is a normal architecture, if there is a necrosis involving the normal architecture maintained, it is known as which necrosis? It is known as the coagulative necrosis. Whereas in a necrosis, this architecture which is being lost, it is known as what? It is the liquefactive necrosis. Factive necrosis. Okay, fine. And this coagulative necrosis, the main mechanism for this coagulative necrosis is the protein denaturation. Okay, protein denaturation. And they are most commonly seen in the solid organs like the spleen and liver. Spleen, liver, and heart even. Okay. And this liquefactive necrosis, they are more common in the parts where there is more enzymes. Okay. When there is more enzymes, for example, in a case of brain and in such a case like infections like abscess. Fine. This is about this initial part of this necrosis. If you see this image, there is both liquefactive plus coagulative necrosis. What do you think of? Yeah, there is a tombstone appearance in the coagulative necrosis. Yeah, the video will be available and the PDF will be shared in your respective group. Okay, fine. There will be latency, so just bear with it. Next one. In which of the following necrosis you will see this both liquefactive and coagulative necrosis? Yeah, the 𝗙𝗲𝗃 one, which is because of which one? Which is because of the presence of the mycolic acid in the TB bacilli. And this is known as which necrosis? It is known as the caseous necrosis. It is known as the caseous necrosis. And it's one of the special type of necrosis. Yeah, it's most commonly seen in the lungs. Next one. If you see this image, you will be able to appreciate this small whitish calcium deposition. We know this is a fat necrosis. And The most common site for this fat necrosis is the high fat containing areas like breast and the gluteal region. Whereas if you see this image, this is not of a breast or a gluteal region, whereas this is of a omentum. In a case of pancreatitis, you will be able to see there is a release of lot of enzymes, and these enzymes come and coagulate this fat, and this leads to this saponification reaction, and this leads to this whitish calcium deposition. So it is what? It is the fat necrosis, and it is most commonly seen in the fatty areas of breasts and gluteal region. Yeah, most of you are getting it correct. Yeah, that's right. That's nice. You just keep going. Okay, you just keep going. Just keep answering in the chat box. And if you have any doubts, you just keep it with you. We'll discuss in the last part of our session. Okay, fine. We'll move on to the next slides. If you see this thing, if there is any trauma or if there is any injury, the tissue may react in two ways. Either it can adapt like a doctor, or it can go for an injury. Means there might be a reversible injury or there might be an irreversible injury. If there is a reversible injury, it can come upon. Whereas in the case of irreversible cell death, in the case of irreversible cell injury, these cells are mainly this nucleus. This is how a normal nucleus looks. Whereas because of this irreversible cell death, this nucleus will get clumped. It is known as the pycnosis. This is how this image of a pycnosis looks like. And if there is a clumping, means then it's an irreversible cell death. It needs to be broken down, and it needs to be broken down in small pieces. This broken down process is known as what? Karyorrhexis. And once it is broken down, it must be eaten up. So it will lead to this lysis of this material, and it is known as karyolysis. Just remember these two images for this cell death and injuries. Okay, fine. We'll move on to our next slide. If you see this slide, like if it is getting adapted like a doctor, means if there is an adaptation, it leads to few changes. For example, in this change where this squamous cell which is being replaced into which type of epithelium? Waiting for your answers. Yeah, this one leads to the columnar epithelium. Columnar epithelium along with the presence of this goblet cells, and this squamous epithelium which is being converted into this columnar epithelium into the goblet epithelium along with the presence of these goblet cells, they are known as what? Intestinal metaplasia. They are known as what? Intestinal metaplasia. Yeah, that's congratulations. Like most of you are getting it correct. Like you just keep this just going on. Okay, you just keep this just going. Like okay, fine. Well, if you see this image, this one, the same Barrett's esophagus, which is the intestinal metaplasia, which is being stained, and this is being stained with a stain known as Alcian blue. And this Alcian blue, it stains which one? It stains the acidic mucin. Acidic mucin. And remember, this metaplasia, they are like a doctors. They are like a doctors. Why? Because they are reprogramming themselves. Means they will reprogram. Means it's the reprogramming of the mainly of stem cells. Okay, fine. And this is completely reversible. For example, you remember, you just went to a country or a state which you don't know the language, but after a while, yeah, that's correct. The PH. Yeah. After a while, when you return back to your home, you will speak the same language. So likewise, this metaplasia is a completely reversible one. And this is the Barrett's esophagus image. And this one is being stained with the Alcian blue. And this Barrett's esophagus, this thing can lead to this malignancy known as adenocarcinoma of the esophagus. Fine. This is about this metaplasia one, means you need to remember one. Next one, if you look onto the stains, first one you just look onto this lipid stain. Means remember, if you are becoming fat, you need to lose fat. Remember, lose fat for LOS for this mnemonic. For lipids, we'll use two stains. One is known as what? oil red O. Oil red O means, remember, in this stain the fat will look as, in this stain the fat will look as red. Next one, if you see this stain, this is known as what? Sudan black B, means in which the fat will look as black. So just remember, it is what? It is the, you lose the fat. So it is what? For lipid there will be oil red O and Sudan black B. Fine. Yeah, that's correct. Most of you are getting it correct. That's really awesome. Okay, fine. Just keep this Josh going on. Okay, fine. We'll move on to the next slide. If you see this slide, you can see this perinuclear. This perinuclear. Wear and tear pigment. Why it is known as wear and tear? We know most of your functions will happen in the nucleus. So if agar koi kaam kar raha, means there will be the kachara. So if someone is working, of course there will be generating waste. So if you see this one, this nucleus will be working and it will generating the waste or the wear and tear pigment, which is what? The lipofused chain. It is the lipofused chain, and we know it contains the lipid. So if it contains the lipid, we can stain with the oil red O or the Sudan black B. Okay, fine. Yeah. Next one, if you see this image, it also looks like lipofused chain, but it is not the lipofused chain. It is the 𝗵𝗄𝗃𝗏. How we will differentiate is the based on the refractivity and also by the staining. And if you see this thing, 𝗵𝗄𝗃𝗏 will be stained by the iron stain. Iron stain, like which one? What is the iron stain you know of? Waiting for your answers in the comment section. Yeah, that's correct. That is the Pearl's Persian blue. Pearl's Persian blue. No, remember, this is not the Pearl's Persian blue stain. This is normal Hutchiny stain. Whereas in the case of Pearl's Persian blue stain, this iron will be stained as blue. Okay, just remember that thing. Okay, next one, we'll move on to some other stains. They are known as the Mason group of stains. Mason stains. In this Mason stains, there are two stains you need to remember. One is this Mason Fontana, and the next one is the Mason trichrome. If you see this Mason Fontana stain, it will be useful for which one of the following to stain which one of the pigment? Yeah, fine. Yeah, that's you are getting it correct. It is what it is, the melanin. Okay, Mason Fontana will use to stain the melanin. Next one is the Mason trichrome. Mason trichrome stain is used to differentiate this collagen from the smooth muscles. Okay, smooth muscles. We know in a case of granulation tissue, if there is a formation of this granulation tissue, there will be abundant formation of the collagen. So if there is a formation of the collagen, we need to differentiate it from the smooth muscle. So we'll stain with the Mason trichrome stain. Okay, you just remember. Yeah, that's you're getting it correct. Next, if you see this image, both of them, it will show this calcium deposition. If you see this calcium deposition, this calcium, it's mainly stained by a stain known as 𝗏𝗏𝗃. To remember this, you remember this famous slipper brand, which is known as VKC. This 𝗏𝗏𝗃 will stain this 𝗏𝗏𝗃 will stain this calcium. Okay, will stain this calcium, and this will be in kala in color, means it will be black in color. Okay, it will be black in color. Remember this one. Okay, fine. Next one is the, if you see this type of calcium deposition, it is also being stained by some other stains. What is the stain you will think of? The stain, one more stain which we'll use for the calcium on. Waiting for your answers. Yeah, it is the alizarin redis. It is the alizarin redis. And we know this calcium, it's most important because it's being repeatedly tested. We know there are two types of calcification. One is known as dystrophic calcification. Another one is known as what? Metastatic calcification. And in the case of dystrophic calcification, if you see, it is happening on the dead or dying tissue. Whereas this metastatic calcification, it will happen in a normal tissue. This, in the case of dystrophic, the calcium levels will be normal. Whereas here the calcium levels will be increased. Okay, the calcium levels will be increased. Okay. Next one. Next one. If you see this image, it's one of the image which is being tested in a case of inflammation. Okay. In the case of inflammation, you will see these traps. They are known as neutrophil entrapment traps. Okay. They are known as neutrophil entrapment traps. These traps, they are done by these neutrophils. And if they are done by the neutrophils, means in which this nucleus of these neutrophils, which comes out and traps the bacteria, it acts as a trap. So it is known as neutrophil entrapments. And you know that after this neutrophil entrapments, this neutrophil will die at the end. Okay, at the end, it will die. You just remember this image. Okay, it has a high probability to be asked in your exams. Okay. Next one. We'll look about some granulomas. What is the name of this type of granuloma you might think of? Yeah, correct. It is the caseating granuloma. Caseating granuloma. It's most commonly seen in a case of TB. And how will identify it? Based on this horseshoe-shaped cells, horseshoe-shaped macrophages. Okay. And what is the name of the cells? They are Langerhans cells or Langerhans cells. Yeah, sure. I will explain about this next in the end part of our lecture. We'll just go on with the flow. Fine. What is the name of the cells? Is it Langerhans or the Langerhans? Yeah, it's the one. It is the Langerhans. Remember these things. Langer. Remember, GER for DER means D for derma. Means in a case of derma, we'll see Langerhans cells. That is, this Langerhans cells is seen in a case of TB. Okay, TB. If you see this one, if you see this type of germ cells, which will be having this both intranuclear and intracytoplasmic, both this type of accumulations, and it will be arranged like a breath. So they are known as what? What is the name of this one? It is known as the Ŵārtiņ-Finkeldi giant cells. In which disease you will see this Ŵārtiņ-Finkeldi giant cells? Yeah, correct. Yeah, it will be seen in a case of measles. What is the type of pneumonia? What is the name of this pneumonia you will see in a case of measles? Yeah, remember, it's known as hex pneumonia. It's known as hex pneumonia. Okay, it's known as hex pneumonia. Next one. If you see this thing, this is being asked in the last FMGE exam. And if you see this, it is a multinucleated giant cells. And this is type of smear which is being used in the dermatology. Okay, this is a type of smear which is being used in the dermatology. Will you name this smear? Yeah, it is known as what? It is known as Zank smear. It's known as the Zank smear, in which if you see this multinucleated giant cells, it will be seen in a case of HSV1. Okay, which will be seen mostly in a case of HSV1. Okay, this one. And if you see this one, which is the Ølli appearance, means like everyone is waiting for this, like Ølli appearance. This one, Ølli appearance. This type of Ølli cells, they are seen in which condition? What is the name of these cells? Will you able to recall? Yeah, correct. They are known as Reed-Sternberg cells. Means you remember, Reed-Sternberg cells, they will be containing this nucleolus as the center part in a red or a pink color. Okay, red or a pink color. Okay, fine. Next one, you can see this one. Okay, you can see this. Don't confuse between these RS cells and the CMV one. In a case of CMV, it won't be in red color, means a pink color. In a case of Reed-Sternberg cell, it will be in pink color, whereas in a case of CMV Ølli cells, there will be blue in color. Okay, or basophilic in nature. Okay, fine. Yeah, that's correct. We can see in a case of Hodgkin's lymphoma. And these are about the granulomas you need to remember. Next one, we'll move on to the genetics. you move on to the genetics, you need to just differentiate between this type of inheritance, like mostly of Mendelian inheritance. Like for this, you need to remember just 2 points. One is this gender. Next one is the generations. One is the gender. Next one is the generation. If you see in a case of autosomal dominant inheritance, there will be no gender bias. Means both male and female will be involved. So there will be no gender bias. Whereas there will be no generation. There will be no skip in generations. Okay, there will be no skip in generations. Means if you see this autosomal dominant inheritance, both male and female will be involved, and all of their generations, first generation and second generations, all of them, they will be involved. Whereas if you see this autosomal recessive type of inheritance, if you see this thing, there also will be no gender bias. Means like there will be both male and female will be involved. And here also you can see there will be both male and female will be involved. But the differentiating feature, what is the differentiating feature will be? Yeah, there will be a skip in generations. You can see there is a one continuous generations which are being skipped. Okay, there will be a skip in generations. Okay, you just remember these things to differentiate the autosomal dominant one from the autosomal recessive one. We'll move on to this next part, which is this X-linked dominant one and the X-linked recessive one. If you see this X-linked dominant one, you just remember like who are all dominant? Who is the dominant? Male or the female? Like most of you are answering, it's like males. No, it's not the males. You just remember females are always dominant. Okay, females are always dominant. So remember this, females are always dominant. So in a case of X-linked dominant disorder, the females will be affected most. Okay, fine. Yeah, the PDF will be shared. Fine. So in a case of X-linked dominant, the females will be affected. Means it will be like father to all daughters. Okay, it will be a father to all daughters. Fine. Next one. In the case of X-linked recessive disorder, remember if female is the dominant one, of course male will be the recessive one. So here the males will be affected. Males will be affected. Okay, and you just remember these 2 points so that you can able to solve the questions in the exam. Don't cram multiple things. If you cram multiple things, you will be forgetting in the exam. Okay, so don't cram multiple things. Keep things, simple things as simple. Okay, that's my idea. We'll move on to this next 2 syndromes. Just remember like how to remember these 2 syndromes. If you see this syndrome, Down syndrome, remember Down syndrome, we know what is the trisomy you will see in a case of Down syndrome. You are getting it correct. It is the trisomy 21. Remember why it is named as trisomy 21 means, and it is Down syndrome. Remember this trisomy 21 means at 21 years also you are single. If you are single, you will be down. Okay, you will be down. You just remember these things. Why you are single? Because someone took your crush. Means here the one is the Robertsonian translocation. So in a case of Down syndrome, you will be able to see this Robertsonian translocation. Okay, and because of this thing, at 21 years old, this child will be he will be down. And if he is down, he will use his hands most for texting. Okay, so if he uses his hands, so he will means the fingerprints will be erased, likewise the crease also will be erased, so that this crease also tells there will be a single crease which tells that he is a single. Okay, there will be a single simian crease. And if he's a single, he won't afford some shoes. Okay, he won't be getting, yeah, like there will be many singles like who will be able to correlate. Okay, there will be, if you're single, means you will be having some less money so that you couldn't afford someone. Okay, fine. So you will be wearing some sandals. So there will be a sandal gap toe. Okay, next one means, and you're trying to put some applications to everyone who are using. So the most common type of leukemia, you won't be hand picking someone. You will be putting applications to everyone. So the most common type of leukemia in the case of Down syndrome is the ALL. So you will put applications for all. And after putting also applications, you won't be getting a proper partner. If you didn't get a proper partner, what you will do? You will cry. So if you cry, you will get this Mongolian eyes. You will cry, you will get this Mongolian slant of eyes. And you will cry and your heart will break. And because of this breaking of this heart, what it will result in? It will result in the endocardial cushion defects. Okay, endocardial cushion defects. And remember, the most common type of ALL means most common type of leukemia, it is the ALL. Fine. Next one, if you just remember one more point, since you are putting applications to everyone, means you are sending requests in Insta to everyone. So you won't remember to whom you send the request first. So in this patient, you will be getting the presenile Alzheimer's. You'll be getting this presenile Alzheimer's. Fine. This is about the Down syndrome. I think so you'll be able to correlate these things more easily if you remember this thing. Fine. Next one, we'll move on to this syndrome, which is known as Turner syndrome. Okay. Turner syndrome. What is the chromosomal defect? It is the 45XO. So remember, it is a girl. Means it is, since it is a girl and it is a short girl. Okay, if she is a short girl, everyone try to bully her. How they will bully them? Means they will call her as O. Means once she walks, everyone they will call it as O. So remember, it is 45XO. And one day she got angry. Means one day she got angry. What she did was she was try to reply them back. She means she want to reply them back. So she was trying to turn. So remember, it is a Turner syndrome. She wanted to reply, so she was trying to turn, but she couldn't turn. Because in a case of Turner syndrome, you will be able to see this verbed necks. There will be presence of this verbs in the neck. So there will be presence of these verbs. And remember, like Down, she is not a single. She is a committed one. Okay, and she is a committed one. So the male variant of this Turner syndrome is known as the Noonan syndrome. And in both of the cases, you will be able to see most of the features just similar, but they'll be having some special features in their heart. So remember, they'll be having streaks in their heart. So means since they are committed, they will be maintaining these streaks in the Snapchat. So remember, she will be having a streak ovaries. She will be having a streak ovaries. And both of them, they are having the cardiac defects. Remember, in the case of Turner syndrome, you will be able to see this two things. One is known as this bicuspid aortic valve. Next one is known as the coarctation of aorta. Okay, this both of these things they will be seen in a case of Turner syndrome. Whereas in a case of boy, which is Noonan, remember, you know, I think so, like boys are always right. So he will be having this right-sided heart defects like pulmonary stenosis. Okay, fine. This is about the Turner syndrome. Let's move on to the next other syndromes. Oh, fine. If you see this thing, this is the 𝗏𝗏 syndrome. In the case of 𝗏𝗏 syndrome, we know. In the case of 𝗏𝗏 syndrome, everything it will be start with P. Means there will be polydactyly, there will be cleft lip and cleft palate. Okay, cleft lip and cleft palate, and both of them in the case of 𝗏𝗏 syndrome, and this is a case of Edwards syndrome. Both of them, you will see this cardiac anomaly known as ventricular septal defect. And in both of them, you will see this rocker bottom foot. Okay, you will see this rocker bottom foot. Okay, you will in both such cases, you will see this rocker bottom foot. Yeah, 𝗏𝗏 syndrome, it's because of this trisomy 13, and Edward, it's because of the trisomy 18. Okay, remember. And in the case of Edwards syndrome, you will see this typical features like this thing is most common in Edwards syndrome, which is this horseshoe kidney. To remember this horseshoe kidney, if you draw this E, means if you draw this both kidneys which are being joined, just like a E, so this Edward is this horseshoe kidney is seen in a case of Edwards syndrome. Okay, this is the thing you can remember for these two syndromes. Let's move on to some part of this systemic part. If you're able to see, what do you think of this one? Where there is a history of sudden cardiac death in a family member. What do you will think of? Yeah, most of you are getting it correct. You will think of the HOCM. Remember, in the case of HOCM, it is due to the defect in the beta-myosin heavy chain. It is due to the defect in the beta-myosin heavy chain, and it is present in which chromosome? Yeah, it is present in the chromosome number 14. It is present in the chromosome number 14. And remember, if you have a good heart or a kind heart, you want to help someone. What do you want to give them? You need to give them some food and shelter. Remember, in the case of 𝗏𝗃𝗃, you'll be able to see this banana shape, which is a food. So banana shape left ventricle is seen in a case of 𝗏𝗃𝗃. And shelter, in the case of microscopy, you will see this helter-shelter appearance. Helter-shelter appearance of this cardiac fibers. Okay, you just remember these two things. Next one. This is how a normal heart, in which you can see this ventricle, left ventricle, which is being hypertrophied. Whereas if you see this one, this is a concentric hypertrophy. Whereas if you see this one, this is a dilated cardiomyopathy. This is what? This is the dilated cardiomyopathy. We know if something is dilated, it will get tight. So it's because of the mutation in the titin gene. It is because of the mutation in the titin gene. Okay, and we know this titin gene, it is the largest one. It is the largest one. Yeah, fine. That's good. We'll move on next part, which is the respiratory part. In respiratory, you need to just remember about these three images. One is this one. This one is known as Kozman spirals. Kozman spirals. Yeah. What is the, from where this Kozman spirals comes from? Wait, if you have answers in the chat box. Yeah, this Kozman spirals, they are actually this tracheal mucosal lines. Okay, fine. They comes from the mucosa of the trachea. And this one, what is this crystal? They are known as the Charcot-Leyden crystals. And they will contain a thing known as galactin 10. Galactin 10, and it is present in the eosinophils. And you will be able to see this body. They are known as what? Crayola bodies. Which is actually what? This is actually what? This is the epithelial cells. Epithelial cells. And all of these three findings, they are typical for asthma. They will be seen in a case of asthma. And could you answer which interleukin is responsible in a case of asthma? Yeah, it is the interleukin 13. Interleukin 13 is responsible for asthma. It plays a major vital role in asthma. Okay, just remember these things. Next one, we'll move on to some other respiratory conditions. In which of the following conditions you will see these asteroid bodies? Asteroid bodies. In which of the following conditions you will see? Yeah, correct. You will see in a case of, you will see in a case of sarcoidosis. And in the case of sarcoidosis, you will be able to see one more thing known as Schauman's bodies. Schauman's bodies. Okay, just remember these two things about sarcoidosis. This is how this asteroid bodies looks like. And in the case of sarcoidosis, remember one more thing. In the case of Gallian scan, you can see this lambda sign and the panda face appearance. Panda face appearance. Okay? Panda face appearance. Yeah, most of you are getting it correct. Next one, we'll move on to the next part, which is one of these occupational lung diseases in which this pleura will get involved. Pleura involved. You can see this pleural thickening. In which of the following occupational lung disease you will get this pleura will get involved? Yeah, most of you are getting it correct. It will be get involved in the case of asbestosis. Remember, most of the following occupational lung diseases, they will come up and they will involve the upper part of the lobes. Whereas this one, asbestosis, it will involve the base of the lung. It will involve the base of the lung. And it involves especially pleura and results in the formation of this pleural plates. And if there is a formation of this pleural plates, and it can result in the cancer of this pleura. And this cancer of the pleura, which is most specific for asbestosis. What is the name of this cancer known as? Yeah, we're getting it correct. It is known as mesothelioma. Mesothelioma. Fine, it is known as mesothelioma. And next one, if you know this mesothelioma, next one. But the most common cancer seen in a case of asbestosis, it's not mesothelioma. The most common one is the adenocarcinoma. It is the adenocarcinoma. And in the case of asbestosis and many other occupational lung disease, you'll be able to see these bodies. What is the name of this body known as? Yeah, you are getting it correct. These are known as ferruginous bodies. Ferruginous bodies. And these ferruginous bodies, they are being, since they are containing this iron, they can be stained with these pearls Prussian blue. They can be stained with this pearls Prussian blue. Okay, so as they are containing the iron, and it will be dumbbell in shape. Dumbbell in shape. Okay, it will be dumbbell in shape. Okay, it is a dumbbell shape. It is a dumbbell shape. Yeah, fine. I will try to use different colors. Fine. Yeah, sure. Next one, in the case of lung cancer, we'll be able to see different findings. For example, in the case of squamous cell, in the case of squamous carcinoma of lung, you will be able to see this thing, wall-like appearance. They are known as keratin pearls. Keratin pearls. Okay, fine. Next one, if you see this one, they are known as a typical pattern. They are known as what? Butterfly and the fence appearance. They are known as butterfly and the fence appearance. And this typical butterfly and the fence appearance, they are seen in a case of which condition it will be seen in a case of? Yeah, sign. Yeah, fine. Yeah, correct. You are getting it correct. Yeah, it is seen in a case of bronchoalveolar cancer. Okay, you are seen in a case of bronchoalveolar carcinoma. Fine. Next one. If you see this image, it will result in a party appearance. Okay, it is known as which party appearance? Or which party? Okay, they are known as 𝗬𝗏𝗏𝗺 effect. 𝗬𝗏𝗏𝗺 effect. They are known as 𝗬𝗏𝗏𝗺 effect, and this is because of this involvement of the vessels in a case of squamous. This will be because of this small cell lung cancer. Because of the small cell lung cancer, also known as port cell. And this small cell lung cancer, it can result in the multiple paraneoplastic syndromes, such as syndrome of inappropriate ADH secretions and Cushing syndrome. What is the one more syndrome which is being associated with small cell lung cancer? Yeah, it is known as Lamberg-Eaton syndrome, and it is due to the because of the antibody against the PQ channel. Means it's actually a calcium channel. Okay, I see a lot of confusion in this image, which is this keratin pearls image. If you see this keratin pearls image, it is seen in a case of squamous cell carcinoma, and there will be one more. Means it's just a different one. There is a one more whirling of calcium, or there is a wall-like deposition of the calcium. Okay, and this whirling of deposition of this calcium is seen in a case of Samoma bodies. Samoma bodies, and we know these Samoma bodies, they are seen in conditions like PSS. They are seen in a case of papillary carcinoma, thyroid, and there will be seen in a case of serous adenoma ovaries and mesothelioma and meningioma. Okay, and remember this whirling pattern, it's different from this keratin pearls. And to see these Samoma bodies, this is actually the calcium deposition. And to see this, which stain you will use? Yeah, correct. We'll use this 𝗏𝗏𝗃 stain. Okay, we'll use this 𝗏𝗏𝗃 stain, in which it will stain as black in color. Okay, it will stain as black in color. And remember one more thing: this Samoma bodies, since they are seen in cancer like papillary carcinoma, thyroid, don't confuse it with this one, which is what? Don't confuse with the metastatic calcification. The Samoma bodies, they are seen in a case of dystrophic calcification. Remember, this Samoma bodies, they are seen in cancer, but they are actually what? They are actually dystrophic calcifications. Okay, remember this one. Samoma bodies. Next one. Yeah. We'll move on to this next slide, which is our based on our mainly kidney slide. And if you see this image, this is how a normal kidney appears on H&E. Right? This is how a normal kidney appears. Whereas if you see this sum, see this typical kind of appearance. What is this appearance known as? What is the name of this lesion? Like you call it as. The correct, they are known as KW lesions. And they are most commonly, they are typical for which one? They are typical for the diabetes mellitus. They are typical for the diabetes. And next, if you see this image, you can able to appreciate this crescent shape. And this crescent shape glomerulonephritis. Remember, it is nephritis. It is seen in which condition? What is the name of this nephritis known as? Yeah, you are getting it correct. They are seen in a case of RPGN. Remember, RPGN, it is a type of nephritic syndrome. And this one, this KW's lesions are diabetes. The most common thing which is being appreciated is the focal segmental glomerulosclerosis, which is actually leading to nephrotic syndrome. And what is this image? Is this a normal light microscopic image or an electron microscopic image? Yeah, most of you are getting it correct. It is an electron microscopic image. And if you see this electron microscopic image, along with this kind of means like effacement of these podocytes, means this effacement of these podocytes, they will be seen in a case of minimal change disease. Okay, they will be seen in a case of which disease? They will be seen in a case of minimal change disease. Yeah, you are getting it correct. And to treat this minimal change disease, which thing you will give? Yeah, absolutely. Since you are doing amazing, like it's correct. Yeah, it is. Will give these steroids. Will give this steroids, which is what? Which is the prednisolone. Which is the prednisolone. Next, let me ask you a few more questions. What is the most common nephrotic syndrome which is seen in children? Yeah, that's correct. It is the minimal change disease. And whereas the most common nephrotic syndrome in adults is the which one? It is the focal segmental glomerulosclerosis. Okay. Just remember in a kidney part this much. And if you want to remember more, you just remember two more points. One is this membranous glomerulonephritis and MPGN. And in the case of membranous glomerulonephritis, it is most commonly seen in elderly and cancer patients, and it will show this pattern known as spike and dome pattern. Spike and dome. This is seen in a case of membranous glomerulosclerosis. What is this type of basal membrane appearance you will see in a case of MPGN? Yeah, fine. You are getting it correct. You will see this splitting of this basal membrane is seen in a case of MPGN. You remember, means between this membranous glomerulonephritis, there is a PK and it's splitting these two. So there is a splitting of this basal membrane. Okay, this is the thing you need to remember about this nephrotic and nephritic syndromes, which are being tested most more commonly. Fine. Next one, if you see this thing, means these are this appearance of the crystals, and if you see this one, hexagonal shaped crystals. These hexagonal shaped crystals, they are most commonly seen in which stones, which kidney stones? Yeah, correct. This hexagonal shape are the six, they are seen in a case of cystine stones. Right? Next one, this appearance. What is the name of this appearance? This is known as what? This is known as this coffin lid. This coffin lid appearance is seen in case of which stones? Yeah, correct. It is seen in a case of this 𝗬𝗏𝗏 stones. Also known as what is the name of other name of this? Yeah, correct. They are known as these triple phosphate stones. Okay, they are known as the triple phosphate stones. Remember this thing. Okay. And this 𝗬𝗏𝗏 stones happens because of the infections like protease, which makes this alkali means which makes this enzyme known as urease, and it makes the urine alkaline. Yeah, you are getting it correct. You are absolutely awesome. Next one, if you see this image, if you see this two image, both of them they are calcium oxalate crystals, but the differentiation, you need to differentiate whether these are calcium oxalate monohydrate or calcium oxalate dihydrate. Remember, if you're single, the same story. If you're single, means either you need to have a good face or you need to have a good body. Fine. To have a good body, you need to do exercise. To do exercise, you need to have some dumbbells. So if you're single, you will use dumbbells. So like dumbbell shaped crystals are seen in a case of calcium oxalate monohydrate. Calcium oxalate monohydrate uses this dumbbell shaped crystals. Whereas once you build your body, you will get committed, means you will try to improve your love by sending messages or emails. Like previously we used to send the mails, like which are known as envelopes. So calcium oxalate dihydrate will see this envelope shaped crystals. So just remember these things to differentiate between the calcium oxalate monohydrate and the calcium oxalate dihydrate. Okay, fine. Yeah, fine. This PDF will be shared in your groups, so don't worry about the PDF. Okay, just work on the contents. Fine. Next one. If you see this rhomboid, appearance, this rhomboid appearance of stones, they are seen in a case of uric acid stones. And remember one more thing, we know this uric acid is radiolucent or radio opaque. Waiting for your comments. Yeah, correct. It is what? It is what? It is the radiolucent. It is the radiolucent. Okay, fine. This is about the crystals you need to remember. Next one, we'll move on to the next part, which is the GAT part. In GAT, you need to remember just 2, 3, 4 images, means like 2 to 4 images. One of them is this one. If you see any pass positive macrophages on the lamina propria. This will be suggestive of which one? Waiting for your answers. Yeah, fine. Yeah, correct. It is seen in a case of 𝗵𝗿's disease. It is seen in a case of 𝗵𝗿's disease, which is caused by the troponin plague. Fine. Next one. If you see this thing, if you see this villus atrophy, see this villus atrophy along this one, or anyone like crypt hyperplasia. Both of these things, they are seen in which disease? Yeah, you are getting it correct. They are seen in the celiac disease. Don't confuse means this pass positive macrophages with this celiac disease. Okay, just this one. If you see this pass positive macrophages, it is seen in a case of 𝗵𝗿's disease, whereas this one villus atrophy and crypt hyperplasia, it is seen in a case of celiac disease. Okay, you just remember. Then, if you move on to this image, if there is any continuous involvement of this bubble, you see this continuous involvement of this bubble, you will think of which of the following inflammatory bowel disease? Yeah, you will think of ulcerative colitis. Whereas if you see some kind of skip lesions, you will see in a case, means it will be suggestive of this Crohn's disease. Okay. We know the most common site which is being affected in a case of Crohn's disease, it is the ileum. Whereas it spares which structure? Yeah, you are getting it correct. It spares the rectum. And we know this thing. Like in the case of Crohn's disease, there will be formation of the strictures along with the fistula. Okay, strictures along with the fistula. Whereas in the case of ulcerative colitis, there will be a continuous involvement. And the most common structure which is being involved is the rectum. What is the antibody which is being in relationship with the Means what is the antibody we will see in a case of ulcerative colitis? Yeah, remember it is the p-ANCA. It is the p-ANCA. Image it's not necessary for you, so just leave it. Other image you just have focus on. Fine. It is the p-ANCA. You know, this because of this p-ANCA involvement, it is also results in the one of the biliary conditions. What is the name of this biliary condition? It is associated with. Yeah, it is associated with one more thing known as primary sclerosing cholangitis. It is associated with primary sclerosing cholangitis. Fine. Next one. In the case of Crohn's disease, we forgot one thing. That is what? It is the cobblestone mucosa. It is the cobblestone mucosa. It is the cobblestone mucosa. Fine. Next one. If you move on to this image, which is mostly about the brain tumors. In the case of brain tumors, you need to remember just few things. One, which is being repeatedly tested. This is the, what is this tumor in which there is a bilateral spread, which is like a serpentine necrosis, means which is also known as this serpentine necrosis, which spreads like a snake. In which tumor it is associated with bilateral spread along with this serpentine necrosis, along with involvement mainly of the frontal lobe. It is what it is seen in a case of glioblastoma. And we know glioblastoma is an aggressive tumor and it is grade 4. And it is of grade 4. Remember these 2 points, it will be enough. And this is the same radiographic image of the glioblastoma. Okay, it is the same image of the same radiographic image of the glioblastoma. Remember these things. Next one. If you see this thing, these are 2 rosettes. Fine. This thing, first rosette. They are known as these 2 rosettes. Are also known as flexner intestinal rosettes. In which condition you will see this type of rosettes? Yeah, correct. Most of you are getting it correct. Yeah, you will see in a case of retinoblastoma. Retinoblastoma. Okay, you see in a case of retinoblastoma. Whereas this type of rosettes, they are known as pseudo rosettes. Remember, overall pseudo means overall false people, means who will live for others. Remember, men. Men always live for others. So remember, for example, in a heart of men, there will be always a woman. So the women, they like the pink color. So in a case of pseudo rosettes, there will be this pink color deposits. There will be a deposits in pink color. There will be deposits in the pink color, and this will be seen in a case of medulloblastoma, Ewing sarcoma, and neuroblastoma. Yeah, it is due to the mutation in the 13q14 gene. Fine. This is about this brain tumor. Next, we'll move on to this blood part. Means these are all the questions which are being repeatedly asked. Okay, fine. We see this type of target cells, along with history of repeated blood transfusion, plus along with microcytic hypochromic anemia. What did you think of? You are getting it correct. You will see, you will think of thalassemia. And you just remember one point about thalassemia. In a case of thalassemia, you will see this index known as Mainzer index. Okay, this Mainzer index, it will be less than, means it is thalassemia, so it will be less. It will be less than 13 in a case of thalassemia, so that you can differentiate this thalassemia from the iron deficiency anemia. Next one, if you see these 2 things, one is known as this white cells and Heinz bodies. This both of these 2 things will be seen in case of which condition? Waiting for your answer. Yeah, correct. You will see these 2 things in a case of G6PD deficiency. You will see this in a case of G6PD deficiency. Whereas in a case of G6PD deficiency, we know G6PD enzyme is required for the HMP pathway. If there is no HMP pathway, there will be no NADPH production. If there is no NADPH, so there will be no NADPH available to scavenge the free radicals. So these free radicals, they will clump this hemoglobin and leads to this formation of this Heinz bodies. To remember this microcytic hypochromic anemia, you can remember by the mnemonic of Sita. Okay, sideroblastic anemia, iron deficiency anemia, thalassemia, and anemia of chronic disease. Okay, it's about the 𝗙𝗵𝗃 disease. Next one, if you come to this one, when in which you will see this hypersegmented neutrophils along with this. What is the name of this bodies? Waiting for answer. Yeah, fine. It is known as the 𝗲𝗲𝗃𝗃 bodies. 𝗲𝗲𝗃𝗃 bodies. Yeah, you know this 𝗲𝗃𝗃 bodies and this hypersegmented neutrophils. Both of them they are seen in the case of vitamin B12 deficiency anemia or the megaloblastic anemia. Megaloblastic anemia. Okay. In the case of this one, this 𝗲𝗃𝗃 bodies, they are actually what? They are actually the nuclear remnant. Fine. They are actually which remnant? They are actually the nuclear remnant. Whereas this one, in the case of 𝗙𝗵𝗃 deficiency, these Heinz bodies, they are actually which remnants? They are the hemoglobin remnants. Okay. Just remember these 2 points about this blood. Next one, if you see this image, after seeing this image, what you will think of? Yeah, I know. You will see this multiple stages or multiple immature cells which are at different stages, and they are seen in a case of acute myeloblastic leukemia or AML. Okay, fine. Next one, in a case of AML, you will able to see these rods. What is the name of these rods? Yeah, correct. I'm getting it correct. Yeah, it is known as the R rods. It is known as the R rods, and it's most commonly seen in the case of which AML, as per previous classification, it is seen in the case of AML M3. It is seen in a case of AML M3, and it is due to the translocation 1517, which is actually what? PML RARA. PML RARA translocation. Okay, just remember just few things about this AML. Next one, if you see these immature cells which are mostly looking similar, what do you think of? I was getting it correct. You will think of ALL. Okay, you will think of ALL. And we know in the case of the most common cause of leukemia in the case of Down syndrome, it is ALL. And this ALL, they are most common in children. Okay, they are more common in children. Remember these 2 points. Fine. Next one. We'll move on to this findings. This actually, what while preparing this smear, the cells, they are being smudged. So you will see these smudged cells. In which condition you will see these smudged cells? Yeah, correct. You will see these smudged cells in the case of CLL. Okay, you will see these smudged cells in the case of CLL. And remember, since you see these cells which are similar, you will name it as schoolgirl or convent girl appearance. Okay, because most of these mature cells, they're similar. Okay, whereas in a case of AML, there will be different sets of blasts. One will be metamyelocytes, there will be myeloblasts, there will be at different sites. So it will look like a more of a college-going girl or during a party in the garden, are also known as garden party appearance. So remember, in the case of CML, we'll be able to see this garden party appearance. Garden party appearance. Okay, you just remember these 2 points in the case of leukemias. Fine. Next one. Where you will see this kind of clover leaf kind of cells. In which condition you will see? Waiting for answers. If most of you are getting it correct, you will see this kind of clover leaf type of cells in the case of mostly in the case of 𝗙𝗵𝗃 syndrome. Okay. 𝗙𝗵𝗃 syndrome, which is actually what means 𝗙𝗵𝗃 syndrome and 𝗬𝗵𝗃 fungoides, which is actually what T type of non-Hodgkin's lymphoma. Fine. Just remember this 1 point about this lymphoma. Next one, what is this name of this Chi appearance? Yeah, this is known as what? It's known as 𝗙𝗵𝗃 appearance. In which condition you will see this 𝗙𝗵𝗃 appearance? Reply in the chat box. Yeah, fine. You are getting it correct. You will see this 𝗙𝗵𝗄𝗃 appearance in a case of Burkitt's lymphoma. Burkitt's lymphoma. We know in the case of Burkitt's lymphoma, there will be a typical African child which is presenting with this jaw swelling. Whereas in the case of Indian scenario, you will see mostly the atypical variants of Burkitt's lymphoma in which the lymph nodes of the GAT will be involved. And what is the translocation you will see in a case of Burkitt's lymphoma? Answer in the chat box. Yeah, correct. Yeah, you are you are ready to blast it. Yeah, it's correct. It's due to the translocation in the 814. Fine. Remember, it is due to the translocation in the 814. Next one, if you see this thing, this hairy cells is seen in a case of hairy cell leukemia. Fine. In the case of this one, HCL, what is the marker? What is the marker you will see in a case of HCL? Is it annexin A1 or annexin 5? Yeah, most of you are getting it correct. It is what? Don't confuse with the annexin 5. It is the annexin A1. Okay, fine. It is the annexin A1. Whereas in the case of apoptosis, the marker is the annexin 5. Okay, fine. The marker is the annexin 5. Just remember, these are the most probable images which, if they want to ask, they will ask in the surroundings. Okay, fine. And you just remember one more thing. If you have faith and hope and confidence in yourself, you'll be able to achieve. Means if you have faith that you could clear your exam, then you're halfway ahead. Means you just need to put a few more efforts. So always have faith that you will get you won't get passed, you will get more marks than passing. So you just remember to have faith always. So if you have faith, you are halfway ahead and you will be passed this exam. Don't worry about other things. Fine. With this same motivation, we'll move on to the next subject, which is the pediatrics. Fine. What is this instruments you will think of? 𝗴𝗿𝗃 answers in the chat box. Yeah, this one is the incubator. It is the incubator. If you think, what is this instrument will you think of? Don't get confused. I told you, don't get confused. Like, this is what? Yeah, sure. Like this thing, it's mainly based on the IBQ discussion. Like for solving questions, we'll do with the granters discussions. Okay, fine. We'll just limit ourselves based on image how we could decode. Okay, fine. That's it. Next one, first one is the incubator. Next one is this. What is this one? This is what? This is the radiant warmer. Okay, this is the radiant warmer. And the mechanism by which the baby gets heat in a case of incubator, how it gets heat? It's by which mechanism? It is by the convection. And how the baby loses the heat? The baby will lose heat by which method? The baby will lose heat by radiation. Whereas this one, this is the radiant warmer. Where will keep this baby? Right? Here, the main mechanism by which the baby gets heat is which one? As it tells, it's what? It is the radiant. So it will be radiation. Whereas here, the baby will lose heat by this air which is being flowing. It is by convection. Okay, it is by the convection. Just remember these two things. And this is how this phototherapy looks like. And we know this phototherapy will use this wavelength between the 450 to 470 nanometers. And what is the mechanism of this phototherapy which we are using? Remember, the most common mechanism, you are getting it correct, and there is some confusion. Like the most common mechanism by which this phototherapy works, it is what? It is the structural isomerism. Structural isomerism, in which this bilirubin will be converted into the lumirubin, which is actually a water-soluble structure which can be excreted by our kidneys. Okay, which can be excreted by our kidneys. This is the most common mechanism. Whereas it means like there is also some other mechanism it can work on, but the most common mechanism is the structural isomerism. The other mechanisms include our favorite photoisomerization. So don't confuse between these two. So the most common mechanism is the structural isomerization. Fine. Next one. We'll move on to the next slide. This is a sign. This is both of the sign. What is the name of this sign known as? Answer in the chat box. Yeah, it is known as the scarf sign. It is used to assess the gestational age of the child. So this type of things, they are used in which one? They are used in the extended Ballard score. Extended Ballard scoring. And if you see this thing, what is the name of this thing? Yeah, you are getting it correct. It is known as 𝗏𝗏𝗴𝗿 feeding. It is known as the 𝗏𝗏𝗴𝗿 feeding. Fine. Means we use different types of feedings based on the age or the gestational age of the child. Whereas in a case of less than 28 weeks old child, the gut will be immature. So as the gut is immature, will give mostly total parenteral nutrition. Fine. Next one. Between 28 to 31 weeks, the gut will be mature. Fine. The gut will be mature, but the baby cannot accommodate this swallowing reflex. Just 1 minute. Sorry for the disconnect. We are back. Fine. The first thing, in a case between the 28 to 31 weeks, the gut will be mature, whereas the baby cannot accommodate the both respiratory and swallowing reflex at the same time. So we'll use this OG tube. Whereas between the 32 weeks and 34 weeks, both of these things will develop. Means the baby will be able to swallow, but still we won't use the breast milk because the rooting reflex won't be developed there. So we'll use this type of feeding known as 𝗏𝗏𝗴𝗿 feeding. Or we can use one more method known as Katori spoon feeding. Whereas after 34 weeks, we can start the breastfeeding directly. Fine. What is name? I'm just asking a question. What is the name of this step? Whose step is? Yeah, correct. The name of this step is what? Is the Shakir step. It is known as what? Shakir step. Fine. Next one. We'll see about few radiological things in a case of pediatric. Fine. If you see, there is a history of cesarean section. Okay. There is a history of cesarean section, and the baby is presenting with respiratory distress. Okay, the baby is presenting with the respiratory distress. Fine. And along with this respiratory distress, you'll able to see this radiological appearance. In chest X-ray, you'll able to see this perihilar streaking and fluids in the effusion in the interlobar fissures. This will be suggestive of which condition? What do you think of? This will be suggestive of which condition? And it is a transient condition. Yeah, this will be suggestive of transient tachypnea of newborn. Okay, as it is a transient condition, it will be resolved by its own within 72 hours. Fine. Next one. If you see this image, you'll be able to see there is this presence of this bowel in the thoracic cavity. Presence of bowels in the thorax. Next one. On grossly, you will able to see this. On grossly, you will able to see this one. This is known as the scoop abdomen or scaphoid abdomen. This scaphoid abdomen. Okay, fine. This scaphoid abdomen. These both of these things, they correlate with which one? They will correlate with the congenital diaphragmatic hernia. What is the most common type of congenital diaphragmatic hernia? You know? Yeah, this is CDH. It is the Воркhdалик hernia. On which membrane is defect in a case of congenital diaphragmatic hernia? We know the membrane which is being defect in a case of congenital diaphragmatic hernia is which membrane? It is the pleuroperitoneal membrane. Okay, and this Воркhdалик hernia occurs in the left side. So just remember these 2 points, it will be enough for you. Yeah, fine. I am getting it correct. Next one, there is a high probability these questions which is being asked. Fine. If you see, there is a history of aggressive formula feeding or avoiding from the breast milk feeding, and the baby is mostly presenting with acidosis along with hypernatremia. And on X-ray, you will be able to see this appearance. What is the name of this appearance? What do you think of? Answer in the chat box. Yeah, you will think of which one? You will think of this thing known as pneumatosis intestinalis. And this thing is seen in a case of nectarizing enterocolitis, and it is seen in a case of stage 2A. Whereas in a case of stage 2B, you need to remember just these 2 stages, stage 2A and stage 2B. In the case of stage 2B, you will be able to see one thing known as presence of gas in the portal vein. Okay, you just remember these 2 things for this nectarizing enterocolitis. Okay, don't confuse it with the double bubble appearance. Okay, it means you will see multiple bubbles here. You will see this multiple bubbles here. But here, if you see between this inner air and the outer air, there is a circle. Means it is because of this accumulation of air between the layers of the intestine. Fine. This is about this X-ray. We'll move on to this few important images which is being tested. If you see this thing, there is a rash on the artificial regions. You will think of which one of the following disease? Yeah, you will think of acrodermatitis enteropathica. And this acrodermatitis enteropathica, it occurs due to deficiency of which mineral? We know it occurs due to deficiency of which mineral? Yeah, you are getting it correct. It occurs due to deficiency of zinc. Fine. And we know it's just a correlation with it. In a patient's, in a child.
Yes, sir.
In a child with diarrhea, we give zinc supplementation. To give this zinc supplementation, if it is less than 6 months old, how much gram you will give? You will give 10 grams, or like 10 milligram. Whereas if it is more than 6 months, you will supplement with 20 milligram of zinc. Fine, I just remember these 2 points. Next one. What is this baby you will think of? A few of you are not in a live, just if you are watching this video in past, just click on the live option so that you will be in track with the class. Fine. What do you think of? Yeah, this one. If you see someone with belly, means if you see someone with belly or the edema, it will be suggestive of the kwashiorkor. And in the case of kwashiorkor, along with this belly, you will see these 2 appearance. Okay, you will see these 2 appearance. Okay, known as what? This one is known as what is this one? This is known as what? This is known as flaky paint dermatosis. And you will see in hair, there is one more sign known as, there is an alternate band of black and white known as which sign? It is known as the flat sign. It is known as what? It is known as flat sign. Remember, in the case of kwashiorkor, there will be presence of edema. Okay, just two things you need to remember about this image. Next one, we'll move on to this image. If you see this thing, in the case of deficiency, in which you will see this cupping, and splaying and fraying, means there will be formation of this cup, and there will be means widening, and along with this elongation over here, so it is known as splaying. So cupping, they are known as fraying. These three, they are typically seen in a case of which deficiency? It is seen in a case of vitamin D deficiency, which is known as what? Rickets. It is known as what? It is known as rickets. And in the case of rickets, what is the name of the regime you will use? Yeah, the name of the regime you will use in a case of rickets, it's known as the Strauss regime. It's known as the Strauss regime. Fine. Fine. Okay, fine. You just remember this one regime known as Strauss regime. Next one, if you see in a condition, you will see this Wimberger's ring. Remember this Wimberger's ring along with this spur, which is known as the Pulkin's spur. This spur shape, this spurs. Okay, these are suggestive of which condition? Waiting for your answers. Yeah, they are suggestive of which one? They are suggestive of the scurvy. And this scurvy, they are also present with one more thing. They are also present with this periosteal hemorrhages. Periosteal hemorrhages. Just remember this thing. Fine. Next one. We'll move on to the next part of our discussion, which is about CVS. In the case of some congenital anomalies, in which condition you will see this snowman appearance or a figure of 8 appearance? Snowman or figure of 8 appearance is seen in which condition? I find most of you are getting it correct. You will see in a case of 𝗙𝗵𝗄𝗃. In which condition you will see this egg on sting appearance? Yeah, you will see this egg on sting appearance in a case of transposition of great arteries. In which condition you will see this thing? First, I will show you this thing. Notching of the rib along with 3 sign. This 3 sign. In which condition you will see this? Yeah, correct. You will see in a case of coarctation of aorta. You will see in a case of coarctation of aorta. And we know there is an association with this Turner syndrome. There is an association associated with this coarctation of aorta. There is an association with the Turner syndrome. Fine. You just remember these 2 points. Next one. What is the name of this appearance of heart? Yeah, you are getting it correct. It is known as what? It is known as the boot-shaped heart. Boot-shaped heart is seen in a case of tetralogy of Fallot. We know in a case of tetralogy of Fallot, we'll see 4 things. What are the 4 things you will see? Waiting for your answers in chat box. Yeah, fine. We'll see first one. We'll see this large VSD along with overriding of aorta along with infundibular stenosis. Yeah, you are getting it correct. Infundibular stenosis. The next one is what? That is the right ventricular hypertrophy. Remember, it is not the left ventricular, it is the right ventricular hypertrophy. We know which one of the following determines the severity of the tetralogy of Fallot? Which one of the following determines the severity of tetralogy of Fallot? We know this one. Infundibular stenosis or the pulmonary stenosis defines the severity of the tetralogy of Fallot. Yeah, you are getting it correct. Just keep going. Right? This one, there are few congenital anomalies you need to remember of. First one, if there is any absent of this cranial cavity or cranial vault, what is this condition known as? What is this one? You will see this frog eye appearances on ultrasound. Yeah, it is what? It is the anencephaly. What is this condition? What is this condition? You will see the absence of neck remember, if there is absence of neck, remember, write this NEC and put there is absent or incubator neck. So 𝗏𝗃𝗃𝗃, you will see this absence of the neck. Okay, you will see this absence of the neck in the case of 𝗏𝗃𝗃𝗃. And if there is a this 𝗏𝗃𝗃𝗃, it's because of this defect in the cranial neuro. Fine. Next one, if you see this growth, around the sacrum, it is known as what? It is the sacrococcygeal teratoma. This is sacrococcygeal teratoma. Fine. You just remember these two things. We'll move on to the next one. Like there are few times these milestones which are being tested. Right? To remember these milestones, means like mostly they will ask about this gross motor development of these milestones. To remember about these milestones, remember how you got committed. If a single, I'm so sorry for you. If you got committed, you know this process more exactly. How I define, right? First, initially, how you will get connected, you will chat. Okay, if you chat, you need to hold your neck. Okay, first you will hold your neck. Fine. If you hold your neck and you start chatting, you will be feeling happy for yourself. If you're feeling happy, and you will start to cuddle with the phone. Remember, you are cuddling with the phone. Fine, you are cuddling with the phone. That is what rollover. It is what it is the rollover. Next one. You started chatting. Okay, you started chatting, and you just want to get know about each other. Fine. Then if you want to know about each other, you are going for a date. And initially you won't call it as a date. So you will go for a coffee shop for a reason. Come, I will teach you anatomy. Come, I will teach you physiology. So you will go with a reason, or you will go with a support. Fine. That is not means the baby will sit with support on 6 months. Means you will sit in a cafeteria with some reasons on 6 months. And next, you won't be having any reasons to sit in the park or the cafeteria. So during 8 months, the baby will sit without support. Next one, after getting committed, you will become late. So later you will start standing. Okay, after a while, you need to have some support to stand. So in 9 months, the baby will start to stand with support. And after standing for a long time, your girlfriend comes late. And girlfriend comes late, if you ask something and she will tell, like, don't be creepy. She will tell, don't be creepy. So the baby will creep around 12 months. If she will ignore you, if she will tell some bad things about you, you will get depressed and you will walk alone. And initially you will walk and you will run to your room. And you will just go upstairs and you want to jump. You will just go upstairs and you want to jump from it. But then you are just remembering, like, you and your girlfriend and your kid to riding a tricycle. Just remember these 3 things, and you're just calming yourself, and you are coming down and you are standing with a single foot in front of your girl's hostel, by convincing the girl. Okay, so just remember in a sequence. First, there will be a neck holding, then there will be a rollover, then there will be a sit with support at 6 months, then there will be a sit without support at 8 months, and 9 months there will be a stand with support, and 12 months there will be a creeping, and 15 months the baby will walks alone, and 18 months the baby will start running. Next one, around 2 years the baby will walk up and down and also jumps. Fine. Next one, around 3 years, remember 3 for riding a tricycle. Next one, around 4 years, it will hop on 1 foot. Fine. This is to remember about the gross motor milestones. And mostly the questions are being asked in the gross motor milestones. And I think so, I just got some relations with the story. If you're able to remember, like, I'll appreciate to remember that. If not, I will tell you just few important one, what do you need to remember in a later part. Fine. Next one, we'll move on with this fine motor development. In the case of fine motor development, just remember initially you use 2 hands, so it will be a bidextrous approach. Fine means, like, if you're watching cricket, if someone is untrained or means any initial phases of training, he will use both hands to catch a ball. Whereas in later part, he will catch with a single hand. So initially there will be a bidextrous reach around 4 months, then there will be a unidextrous reach. And in this unit, remember, is the pincer grab, or the mature pincer grab will appear by 12 months. And by 12 months, you remember this one single point, which will be enough. Next one. In a case of social milestones, you just remember at 9 months, it will waves bye-bye. Fine. And 18 months, if copies the parent's tasks, also known as domestic mimicry. Domestic mimicry. Fine. You just remember these two things. Next one, around 3 months, in a case of language milestones, you just remember 3 for C. Around 3 months, the baby will pose. Fine. And 6 months, it will use monosyllables. And 12 months, it will speak 1 to 2 words with meaning. Fine. This is the things you need to remember about language milestones. And let me enhance with few important ones. For example, in a case of 6 months, you just remember 6 months, S for single. Okay, means if you're single, you'll be always sitting alone. So it sits alone, or it will sits alone or sits with support. Okay, and if you're single, you are no one to talk. So you'll talk you will always talking to your mother and father. So you'll call us ma, pa. So it will use only monosyllables like ma and pa, and it will use just one hand. It will be always using only one hand to text. So remember, means if you're single, you will always just use one hand to text. So it is unidextrous grasp. Fine. And you will tell, if you're single, you will just tell to the mirror each day that you are better, you deserve better. So just remember it for the mirror play. Fine. This is about the 6 months. Next one, we'll move on to the 18 years or the 18 months. In 18 months, you just remember as 18 years. In 18 years, you have freedom to come out of your home. So means, you know, in your home, you will be within some drawn limits. Like, so to draw some limits or to draw some line, you need to know how to draw a line. So during 18 months, the baby will draw a line. Okay, the baby will draw a line. Then, if you want to come out of the home, you need to run from the home and come. So the baby will run at 18 months. Next one, if you come out of a home, you need to feed yourself. Whereas in your home, your mama and papa, they will be feeding you. Whereas here, you need to spoon feed yourself. So you need to spoon feed yourself. And if you come out of your home, you need to just read also, right? If you want to read, you need to turn the pages. So here, the baby will turn 2 to 3 pages. It will turn 2 to 3 pages. Once you studied, you will need to walk. So it will start building 3 cubes by 18 months. Okay, just remember, by 18 months, the baby will start building 3 cubes. Okay, this is about to remember the 18 months. Next one, you remember this 3 years. This third alphabet, it is the C. So it will draw which one? It will draw the circle. Next one, it also will write the tricycle by the 3 years of age, and it will know 3 things. One is the name, age, and the gender. Okay, just remember, because if you want to get a license, you need to ride some bike. So since it's a baby, we'll just give her a tricycle and to ride. And for us, they tell us to make 8. For us, baby, they need to make some circle. And if you make some circle and you want to get license, once if your police caught up, you need to tell your name, age, and gender. So you just remember in this way. So it will be easy for you. Okay, this is about the most of the pediatric part which you need to remember, and rest it will be asked from the conceptual part only. Fine. So you just remember one more saying: well done is better than well said. Most of the people, like, were not able to achieve. They will always tell you cannot do this, you cannot do this. But you just remember, if you're done with the exam and if you show with the results, they will be amazed. So you just always try to work on yourself and show with your results, not by your oaths. Okay, don't reply them now, reply them with your results. Fine. With the same motivation, we'll move on to the final part, which is the obstetrics and gynecology part. Fine. I think so. Everything is settled now. If you have any queries, just let me know if there is any troubles. Is it all fine? Reply on the chat box, please. Fine. That's nice. Then we'll move on to the next part, which is the gynecology part. Fine. This will be like this. This also will be done in around 30 to 40 minutes. Like will be done. Fine. First one. If you see this thing, where you will able to see this bone powder appearance on the laparoscopy are the matchstick head appearance of these deposits of this endometrium, of this functioning endometrium outside the uterus. What did you call it as, or which condition is it related to? Yeah, that's nice. Most of you are getting it correct. It is what it is related to. Which one? It is related to the endometriosis. And we know in the case of endometriosis, it is because of the presence of functioning endometrium outside the uterus. Okay. And what is the most common site of this endometriosis? I were getting it correct. The most common site of this endometriosis, it is the ovary. And if it occurs in the ovary, it leads to this type of cyst known as chocolate cyst. And the patient will be presenting with initial features. The patient will be having these clinical features of infertility and painful sexual intercourse, which is what? Dyspareunia and progressive dysmenorrhea. Just remember these things about the endometriosis. Next one, if you see this irregular appearance of the uterus, which condition you will suggest you will think of? Yeah, fine. Most of you are guessing it correct. You will think of which one? You will think of the fibroid of the uterus. You know, fibroid, it is the most common benign condition in uterus. And what is the most common change this fibroid may lead to? What is the most common degeneration, like most common thing, most common fibroid lead to? It leads to the hyaline degeneration. Fine. We know the least common one is the malignant transformation. What is the type of fibroid changes you will see in a case of pregnancy? What is the name of this degeneration? Yeah, most of you are getting it correct. It is what? It is the red degeneration. And it is the red degeneration. With this, we'll move on to the next part. If you see, there is a regular enlargement of uterus, which will be not more than 14 weeks. And this gross appearance, it will be suggestive of which of the following? Or you can say the presence of endometrium in myometrium of uterus. What it is known as? Yeah, correct. It is known as what? It is known as adenomyosis. Just remember, it is known as adenomyosis. Fine. We're getting it. Next one. If you see this one, what is this thing you will think of? You can see this central stroma. Central stroma, along with peripherally arranged anovulatory follicles. These are seen in which condition? They are seen in a case of PCOS. What is the name of the criteria you will use in the case of PCOS? Yeah, you are getting it correct. It is known as what? It is known as the Rotterdam's criteria. We know there will be a USG finding in this. There will be USG finding of more than 20 follicles, which will be of less than 9 mm in diameter, which is of anovulatory or atretic follicles, and there will be a hormonal change, or there will be a increased testosterone changes, either biochemically or physically, or there will be one more thing, which is what? which will be the menstrual abnormalities. Fine. Like oligomenorrhea. There will be, just remember, some menstrual abnormalities. Fine. This is what PCOS. What is the drug of choice? Drug of choice for treating infertility in PCOS? What is the drug of choice for treating infertility? Just infertility? Yeah. The drug of choice is that it is the letrozole. It is the letrozole. Just remember. And don't confuse this PCOS with this image. What is this image suggestive of? You can see there is absence. In this image, you can see there is no stroma. There is an absence of stroma, and there is a history of multiple HCG injections or treatment history of treatment of infertility. And they are presenting with vomiting. What do you will think of? Yeah, correct. You will think of ovarian hyperstimulation syndrome. Okay? Ovarian hyperstimulation syndrome. Yeah, you are getting it correct. It is ovarian hyperstimulation syndrome. Fine. Next one. Just differentiate. Let me ask you a question. This HSG image is suggestive of what it is suggestive of? Option A. It is suggestive of unicornate uterus. Option B. It is suggestive of arcuate uterus. What do you think of? Answer in the comment box. Fine. Most of you are getting it correct. This one, this is actually what this is, the unicornate uterus. Remember, don't think that arcuate uterus will be arc shaped. No, it is a unicornate uterus. Whereas this one, this is how this arc shaped one looks like. This is the arcuate uterus. Fine. What is the name of this cannula which is being used for the HSG examination? What is the name of this cannula? Is it Commons cannula? Yeah, most of you are getting it correct. It is known as what? It's known as Leach-Wilkinson's cannula. Fine. It is the Leach-Wilkinson's cannula, which is used for the HSG examinations. Fine. And this HSG examination, which suggesting of beads on fallopian tube, is suggestive of which of the following infection? Yeah, correct. Yeah, most of you are getting it correct. It is because of this TB of the fallopian tube. And what is the most common route of spread of this TB? What is the most common route? Yeah, it is what it is there. Hematogenous spread. Okay, just remember this one. Next one. If you see this filling defect. You see this filling defect in an HSG image, and this filling defect in the HSG image, and which correlates with this one more appearance known as honeycomb appearance. And both of this are suggestive of which condition? Both of this, they are suggestive of which syndrome? What is the name of this syndrome? Yeah, it is suggestive of the Asherman syndrome. This Asherman syndrome, it's mainly because of this over-curettage. Because when during curettage, if you take out this functionalis layer along with this basalis layer, it leads to the formation of these adhesions of the synachiae, and it results in this Asherman syndrome. Just remember this points. Fine. Next one. We'll move on with the next thing. What is this appearance? It's known as, what is this appearance? Answers on the chat box. This is known as violin string appearance. In which condition you will see this appearance? What is the name of this syndrome? You are getting it correct. It is seen in the case of 𝗏𝗃 syndrome. Okay, it's in the case of 𝗏𝗃 syndrome. Which organism is responsible for this 𝗏𝗃 syndromes? Yeah, we know it is actually what it is, the perihepatic adhesions. It is the perihepatic adhesions, which is due to the infections mostly with this chlamydia and Neisseria gonorrhea. Fine. And Neisseria gonorrhea. Just remember these 2 points about these 2 syndromes. Fine. We'll move on to the next few of the PIDs. Fine. In the case of Trichomonas vaginalis, you can see this organism and you can see these 2 things. What is this name of this appearance? What is the name of this fruity vagina? You are getting it correct. It is what it is, the strawberry vagina. This is the strawberry cervix. Actually, it is the cervix. It can also involve the vagina. So it is the strawberry cervix. And it is seen in the case of Trichomonas. And Trichomonas, it will produce this discharge known as greenish. Remember, it is a greenish. And you can see this some froth. Means you can see some air bubbles. And these air bubbles, they are known as greeny frothy discharge. It is known as greenish frothy discharge. Fine. This you will see in a case of Trichomonas. Whereas in which condition you will see this type of cells? First of all, tell me what is this name of this cells? Yeah, Trichomonas, it is a flagellated protozoa. Yeah, that's correct. In which condition you will see this type of cells? The name of the cells is, it is the correct. You are getting it correct. It is the clue cells. You will see in a case of bacterial vaginosis. What is the name of the criteria you will use in a case of bacterial vaginosis? Yeah, you will use this criterion as Amsler's criteria. Okay, fine. We know both of these Trichomonas. And this bacterial vaginosis, they happen in the alkaline pH. Whereas this only one PID which happens in the acidic pH. It's our favorite candidiasis. And to find out this candidiasis, you can see this 𝗏𝗃. You can see this 𝗏𝗃 like a card. 𝗏𝗃 whitish discharge. 𝗏𝗃 whitish discharge. Whereas in the case of bacterial vaginosis, you will see this dirty whitish discharge. Dirty whitish discharge. Fine. Yeah, you're getting it correct. That's correct. That's awesome. Just keep going. Fine. Let me ask you one more question. What is the drug of choice for this Trichomonas vaginalis? Or the treatment of choice? Yeah, you're getting it correct. It is what it is, the metronidazole. Fine. It is the metronidazole. Fine. Next. This is about the PIDs you need to remember. Fine. Next one, we'll move on to the types of pelvis. Means last time it was tested, there is a high probabilities this related images might be being tested. Fine. What is the most common type of pelvis you know? Answer the chat box. Yeah, fine. We know the most common type of pelvis, it is the gynecoid pelvis. Fine. And what is this pelvis in which you will see this flat shaped pelvis? What is this pelvis? It is what it is, the platypod pelvis. Next one. In the case of next one, it is the android pelvis. Remember this android pelvis, it is a triangular shaped pelvis. And in the case of android pelvis, you remember if you are an android user, or if it means like remember as an android user, if you're an android user, you will just do 3 things. First thing, watching reels on Insta. Next, sharing the reels to your friends. The third thing will be just watching the reels which are being shared by your friend. So it will be, you will be trapped inside this triangle. So you will be watching reels, you'll be sharing reels, and you'll be again watching the reels which are being shared by your friends, which are irrelevant to you. Fine. So it will be in the triad. Next one, in the case of Android pelvis, you just remember as a mnemonic, the Android phones, they usually hang. Means the old generation's phone, they usually hang. So remember, in the case of Android pelvis, it results in the deep transverse arrest. Deep transverse arrest. Fine. Next one, this anthropoid pelvis. This is how this anthropoid pelvis looks like. this anthropoid pelvis, it results in one type of delivery known as phase to pubis delivery. Phase to pubis delivery, and it results in the persistent occipito-posterior position. Just remember these 2 points about this type of pelvis, and the most common one is the gynecoid pelvis. Okay, that's it about this pelvis. We'll move on to the placentas. Fine. What is the name of this placenta? First placenta you will be able to see. 25 answers in the chat box. It is the placenta which is having the accentuate lobe, means there is a presence of this extra lobe in it, and this could have a risk factor of which one of the following? Yeah, it will be having a risk factor of the postpartum hemorrhage. It will be present as mostly as a primary postpartum hemorrhage or a secondary one? Remember, this as far as it will be always or mostly present as a secondary postpartum hemorrhage, okay, or a late presentation. And this is how this circumvallate placenta look like. This is how this circumvallate placenta look like. Just have a image-based orientation of it. Next one, if you see this other placenta, if this cord, which if it prematurely separate before joining into the placenta, it is known as what? It is known as the velamentous insertion of this cord. Just let me ask you a question. This velamentous insertion of this cord can result in which type of, it will be having which risk factor to which condition? Yeah, it can result in the 𝗲𝗵𝗴𝗺. And we know in the case of 𝗲𝗵𝗴𝗺, the blood which is being lost, it is from the fetal side. From the fetal side. You just remember this thing. And you try to differentiate between the circumvallate and the circummarginate. You just remember circumvallate, it will be looking like this, whereas circummarginate, this marginate, you will be able to see this thick one on the margins. Fine, on the margins. Fine, that's it. And this is how this battledore or the marginal insertion, this is how this battledore placenta looks like. Remember, in the case of battledore placenta, the vessels will be separated after insertion only. The vessels will be separated, whereas in the case of velamentous insertion, it will be a premature separation, so it can result in 𝗲𝗵𝗴𝗺. Fine, that's it. Next one, we'll move on to a few other conditions. Fine, this is how our placenta previa looks like. This is how this placenta previa looks like. Initially, there might be a low-lying placenta which doesn't come and covers the hose, whereas there might be, if it touches the margin, it is known as marginal placenta. If it covers half, it is known as partial placenta. You just have this orientation on the image. It means there is a high chances, a high probability to be tested in the upcoming exams. And if there is a complete placenta, it will completely obstruct the hose. Fine. What is the name of this regime you will use in a case of placenta previa? Answers in the chat box. Name of the regime you will use in a case of placenta previa? Yeah, correct. You will use the regime known as 𝗵𝗂𝗃 and Johnson's regime. Fine. 𝗵𝗃 and Johnson's regime. Next one, if you see, there are different types of morbidly adherent placenta. Morbidly adherent placenta. And this morbidly adherent placenta may happen because of this absence of one membrane. What is this name of the membrane which is being absent in this morbidly adherent placenta? Answers in the comment section. Yeah, it is due to the absence of this 𝗵𝗵𝗃 membrane. 𝗵𝗵𝗃 membrane. And based on the level of involvement, there will be like accreta, increta, and percreta. Okay, there will be, remember as 𝗵𝗵𝗃. Okay, 𝗵𝗵𝗃 as accreta, increta, and percreta. Okay, remember accreta, increta, and percreta. Fine. And what is the most common risk factor for this? Morbidly adherent placenta. The most common risk factor is the previous history of placenta previa. This is the placenta previa. Or the next one is the LSES. Don't answer at LSES in the first go. The first or the most common risk factor is the previous history of placenta previa. Fine. Next one. Then we'll look on to some other things, which is this abruptio placenta. Abruptio placenta. We know this abruptio placenta is due to the premature separation of the placenta. Fine. It is due to the premature separation of the placenta. And there will be two types. There might be revealed one where you will see this perivaginal bleeding, and there will be some kind of concealed ones where you will just see the pain. You will just see the pain along with pallor, which is out of proportion to the pain or out of proportion to the bleeding. Okay, this is how this abruptio placenta looks like. And if this abruptio placenta is severe, and if there is a more accumulation outside the uterus or when it invades the myometrium, what is the name of this uterus known as? Answers in the chat box. It is known as 𝗲𝗏 uterus. It is known as 𝗲𝗏 uterus. Fine, you just remember this. Fine. I have to get correct. Then we'll move on to just simple sign. What is the name of this sign? You will see in it is a sign of pregnancy. What is the name of this sign? What is the name of this sign? It is known as the 𝗙𝗵𝗲. 𝗙𝗵𝗲, which is actually what it is there. It is the purplish or the bluish discoloration of the cervix and the vagina. Next one, this is how this episiotomy is done. And this episiotomy, it's of two types. This is one is known as what? This is the medial episiotomy, and this one is the mediolateral one. And we know this mediolateral one, this extendable one, and we can extend it as T or J shape. And because of this, it has an advantage. Whereas this medial one, we cannot extend it because there will be, if we extend, there will be injury to which one, which structure? Answers in the chat box. There might be a injury to the anal sphincter. Anal sphincter injury. So we'll avoid this thing. Fine. Next one. This is about the episiotomy. We'll move on to the next part, which is about the twins. Just remember about this days and the types of twins. Remember, you and your friends, you are meeting in a coaching institute, or you and your friends, you are meeting in your college. First time before you are meeting, you don't know each other. So you meet in a cafeteria. For first 3 days, you don't know. So you will pay the bill separately. So you will pay the bill separately. So it will be dichorionic diamniotic. Fine. After 3 days, after 4 days, you will be seeing both of you are repeatedly coming to the same canteen at the same time. So after 4 days, you will think bro, don't worry, I will pay. So one will pay, but later what you will do means, yeah, it's just a new friendship, so I don't want to spoil. So you will split it up. So monochorionic diamniotic pregnancy or monochorionic diamniotic twins will happen between 4 to 8 days. And after 8 days, like most of you will become the close friends, and with whom there is extra cash. So the only one person he will pay. So there will be, if it is after 8 days, there will be a monochorionic and monoamniotic twins. Fine. Next one. If it is after 14th day, you will become close friends, or you will become the conjoined twins. Just remember these tricks to remember these days for this twin. Fine. Next one. Sure. Then next one is the two ultrasound signs. To remember this, if some of your friends, they are chubby or moti, will call them as we'll call them in a lovely fashion as laddu. Okay, remember, we'll call them as laddu. So in the case of dichorionic diamniotic twins, you will see the lambda sign. In the case of diamniotic dichorionic twins, you will see which sign? You will see this lambda sign. Okay, lambda sign are also known as twin peak signs. Whereas in the case of monochorionic twins, you will see this T sign. Okay, you will see just this T sign. Okay, fine. You just remember these 2 points, it will be enough for you. And this is how this lambda sign looks like. We're able to draw the lambda even in the case of lambda signs. Whereas in the case of T sign, it will be just thin one. Okay, it's just a thin one. Just remember these things. Fine. Now you can remember as Moti or Didi, Moti and Didi are Moti Laddu. Fine, it's up to you. My next one. What is the name of the procedure which is being done in a case of incompetent cervix? What is the name of this procedure? Or what is the name of the cerclage? Yeah, you are getting it correct. It is known as the McDonald's cerclage, which will be used in a case of cervical incompetency. Okay, cervical incompetence. Fine. How will you means what is the centimeter? You will decide, means after which centimeter you will decide it as incompetent cervix. Answers in the chat box. Yeah, you are getting it correct. After or less than 2.5 centimeter, you will decide it is a incompetent cervix. Next one, you will see what is the name of this suture? Yeah, we're getting it correct. The name is the B-Lynch suture, which is being used for the postpartum hemorrhage. Fine, which is used for the postpartum hemorrhage. Next one, this is how this partogram looks like. This is how this WHO partogram looks like, and where you will be able to see this CTG values and variations. Remember, this V type or this, if both of this fetal heart rate and the contractions coincide, okay, coincide or like they are kissing, means early stages you will kiss. So early deceleration will show this kissing type of changes in the CTG. Next one, if it is a late deceleration, if it is a type of late deceleration, it will show you this U type. Okay, early one it will show this V1, late it will show this U type, which is because of this U, which is the uteroplacental insufficiency. Fine. Next one, this variable type of deceleration, this variable type of changes in the heart rate because of this variable contraction, it is seen because of this umbilical cord contraction. You just remember, variable deceleration, it will be seen in a case of umbilical cord compression, whereas this late deceleration will be seen in a case of uteroplacental insufficiency, whereas earlier deceleration is because of this head compression. Okay, out of this head compression on earlier deceleration, it's almost normal. Fine, you just remember. And this is how this WHO partograph looks like, and this is the CTG or cardio topography monitoring. Fine, in which we measures both heart rate and the uterus tonicity. Fine, just remember these two things. We are around the end of our session, like it will take around 10 minutes, so just bear with us. Fine. What is the name of this method? Contraceptive method? Answer in the chat box. Yeah, it is known as the Tirumala method. It is a type of natural contraception. And you can see this cervical mucus method, which is also known as the Billings method. And you can see these two contraceptives. What is this condom? It is whose condom? It is the male's condom. And this is the female's one. And this male's condom, they are marketed as Nirodh. Fine, you just remember. Fine, they are marketed as Nirodh, whereas this one, this female condoms, they are given by the National AIDS Control Program, in which the most common type of this one, which is being in circulation, is the FC, two types of condoms. So just remember one. Next one, it is the Dutch caps or the diaphragm. It is the Dutch cap or the diaphragm. Just remember this one. Fine. Next one, we'll move on to the some few types of hormonal contraceptives. You just remember Mala N. If there is a N, like both of them, they contains both ethinyl estradiol along with levonorgestrel. Okay, ethinyl estradiol, which is of 30 microgram, and levonorgestrel, which is around the 150 microgram. Both of them, they contain the same, but the difference comes with this thing, N and D. Means N means it's for no money, and D means it's dollar. Remember as dollar, or it's sold as a, well, it's given for 1 rupees. Please remember. And this is how this thing means how these tablets look like. These contraceptive pills, out of which 3 of them they contains these hormones, and 1 they will be having this iron tablets, and this will be having this ethynyl estradiol along with the levonorgestrel. Just remember these 2 things. Fine. This is about you know to remember. Next one, you can remember this injectable one, which is marketed as the Antara, which will be having this medroxyprogesterone injections, which will be in injective form, which will be given once in 3 months. Okay, just remember. And one more thing, you just remember, it is the contraceptive of choice for sickle cell anemia patients. It is the contraceptive choice for sickle cell anemia patients. Fine. Next one, this one, 𝗀𝗃𝗃, also known as, which is chemically as 𝗲𝗏𝗃𝗃. And this 𝗲𝗏𝗃𝗃, initially it is taken twice a week for how many months? Yeah, it is taken twice a week for how many months? For first 3 months. Whereas after that, you will take once a week. You just remember these things. Next one, we'll move on to this intrauterine contraceptive device. Fine. In the case of this intrauterine contraceptive device, first one, these are this first generation one, which is known as the Lippel's loop. In this Lippel's loop, it mainly acts because of this foreign body reaction. Second one, you will be able to see this copper underarm. What is this one? Answer in the chat box. Yeah, you are getting it correct. It is what it is, the copper T380A. Fine, because arm you can see this copper coils, and it will be having the lifespan of 10 years. It will be for the 10 years, and this one will be having this structures to promptly adhere to the uterus. They are actually what? They are known as the multi-load 375, and it will be having a lifespan of 5 years. And what is this one? Yeah, what is this one? This is the Mirena. It is the Mirena, and it contains how many grams, how many mg of the drug? It contains 52 milligrams, and it releases 20 micrograms per day. Okay, just remember 20 micrograms per day. Fine, you're getting it correct. What is this plant? You're able to see this is the Gnaw plant. And this Gnaw plant, you can see there will be 6 capsules, 1, 2, 3, 4, 5, and 6. And it is given as an implant, and it will be having 6 implants. And it will be given for how many years? You are getting it correct. It will be given for 5 years, and this will contains the levonorgestrel. It will be containing the levonorgestrel. Fine. Next one, we'll move on to the few tests, for example, or few instruments. This is, what is this one? This is the IH spatula, which is used to take samples from both, which is used to take samples from the cervix, ectocervix mainly. Next one, this is the brush, or the cervical brush, in which we can take samples from the endocervix. Next one, this is the broom. Okay, this is the broom. Okay, in which we can take samples from both endo and ecto cervix. You just remember this as an image based one. Fine. Next one. What is this test which is being done here? Yeah, you are getting it correct. It is the visual inspection under acetic acid. Visual inspection under acetic acid, which is the most cost effective manner. Fine. Next one. What is the name of this test? It is known as the Q-tip test, which is being used for the stress urinary incontinence. It is used for the stress urinary incontinence. Fine. Next one. And this one, which is being used for the fistula, level of fistula. Fine. In this case, in this procedure, what we will do is we'll stain this urinary bladder with the blue dye. Okay, and we'll keep 3 packs. Fine. And if there is a filling of this first pouch along with urine, means it will be a ureterovaginal fistula. Fine, it is a ureterovaginal fistula. Next one, if the first one, if it is filled with the blue dye, then it will be the 𝗵𝗫𝗂𝗃vaginal fistula. 𝗵𝗫𝗂𝗃vaginal fistula. Okay, fine, you just remember. And if it is filled on this below sides, it will be because of the urethral fistula or ureterovaginal fistulas. Fine. And what is the most common cause of this 𝗵𝗫𝗂𝗃vaginal fistula in India? Yeah, you are getting it correct. The most common cause is the obstructed labor. Okay, it is the obstructed labor. You just remember these 3 points. Fine. Then we'll move on to this. Just only one slides with. Then we'll move on with some instruments. Fine. And this is how this menstrual regulation syringe looks like. This is how this menstrual regulation syringe looks like. First image. Next one, if you see, this is the manual vacuum aspirator. Fine. And this one is the Commons cannula. Fine. These are all used for the MTP procedures. And this manual vacuum aspiration, what is the pressure which is being generated? Answer in the chat box. It will generate the 660 millimeter of Hg. It will generate 660 millimeter of Hg pressure, and it can hold up to 60 ml of content. Fine. You just remember. Okay, these 2 points. This is about instruments, and like we'll move on with the instruments. And this is how this episiotomy scissors, which will be non-traumatic in nature, and this is how this Hegas dilator, which will pass into the cervix to know the dilatory range. This is how this cusco speculum look like, which will be self-retaining in nature, and this will be this ovum forceps will be having this scoop. Will be having this scoop. Next one, this is how this uterine curettage will look like. It's look like similar to a tongue cleaner, which will do curettage. If we do over curettage, it results in the Asherman syndrome. Fine. Next one, one is the Valsalm forceps, which will use to hold the cervix during like cerclage in a case of cervical incompetence. Fine. And this is how this Sims speculum look like. Fine. These are about the few instruments. And to know about these forceps, if you want, you can just go through these images. For just your reference, I'll just tell you about this outlet forceps. In the case of outlet forceps, you can see this. You can see this long one, means it will be longer in nature, and this curvature will be at the end. And in the case of Killian forceps, you will see this one. Okay, see this one. See this rectangle kind of thing in the case of Killian forceps. Fine. This 2 forceps you will be able to differentiate. It will be more than enough. And this is how a traction in a forceps looks like. And this is all about today. Okay, fine. This is all about the sessions for the today. And first and finally with the motivation, like fine. There will be we know there is no substitute for victory. And once you get the victory, means everyone will try to get a part of your victory. Okay, but for that you need to get a victory. So just keep hard and just keep working on yourself, so that it will be pushing yourself into a much extend or a much good part of yourself, and you will be coming with flying colors. Okay, that's all about today. We'll be meeting you in upcoming 3 more sessions, and if you have any questions, you just stay back in the session. We'll be answering your questions. Fine. This PDF will be shared in your groups. Fine. Thank you. Just post your queries in the chat box. Yeah, this session will be kept alive. Yeah, thank you. See you in the next session. If you have any queries, just drop it here. Yeah, fine. I think so. There is no any queries. Then see you in the next session. Bye-bye.